We're all set? Okay. Are our friends in the media ready for us to proceed?
Good to go.
Awesome, okay. Well, thank you for joining us. Pleased to be joined today by Rebecca Radofsky, Clinical Chief of Primary Healthcare, Eastern Health, and Ron Johnson, Chief Operating Officer of the Urban System. We're here to speak today about another measure that we're implementing to address the challenges in our healthcare system. We know the unprecedented pressures facing the health sciences complex and the St. Clair's hospital emergency departments due to a combination of factors, including shortages of healthcare professionals across the care continuum, limited access to primary care, and increased acuity of patients presenting at emergency departments. We also know that we have to continue to find innovative solutions to help alleviate these pressures. Over the past 5 years, we've seen, on average, over 38,000 patients with non-emergent needs present annually at our 2 emergency departments in St. John's. And while Eastern Health responded with a community walk-in clinic in 2022, which diverted thousands who may have presented at one of those emergency departments, we know an additional access point is necessary for non-emergencies. So I'm very pleased today to announce that Eastern Health has issued a request for proposals for the procurement of space in the St. John's metro region to support the establishment of an urgent care centre. Urgent care centres provide access for unexpected, non-life-threatening concerns. The new centre will provide patients with another option in accessing patient care, as well as to help ease the pressures on our acute care emergency departments. It will also allow the right care to be delivered in the right location. Once the RFP is awarded, a space is determined, the anticipated hours of operation for the urgent care centre will be 12 hours per day, 7 days a week. Patients would be seen via walk-in, online, or telephone bookings on a daily basis. Staffing will consist of an interdisciplinary urgent care team, which will include physicians, nurses, both RN and PN, nurse practitioners, X-ray technicians, lab technicians, delivering primary and urgent health care. We are also cognizant of the recruitment and retention challenges that are being experienced across the entire care continuum. So we are working with Eastern Health on strategies that will help offset these challenges. While it is difficult to feel the immediate impacts resulting from initiatives like this one today, significant change takes time and the solutions are complex, but it is all part of a larger plan. It is our combined hope that once operational, we will start to see meaningful differences to the strain placed on emergency departments in the metro region. With that, I will ask Dr. Radofsky to say a few words.
Thank you. This urgent care center is indeed a welcome announcement for both physicians and the patients that we care for. It will provide extended typical primary healthcare setting for individuals who require same-day or next-day access to care for unexpected, non-life-threatening health concerns. At the center, urgent care will be available to patients without a primary care provider, as well as to those attached to a primary care provider who may be unable to receive timely access to care. Given the current pressures and challenges being experienced in both primary healthcare settings and in the emergency departments in Metro St. John's, the Urgent Care Center is a welcome addition to the care continuum, addressing a gap that currently exists for same-day urgent care. Thank you.
Thank you, Dr. Radofsky. I'm also pleased to be here today to participate in this very important announcement. You know, we're very committed at Eastern Health to providing safe and accessible healthcare options for our clients, our patients, and of course their families. And this is a good step in the right direction. We know across Canada that urgent care has been very successful. These clinics provide same-day access for urgent and non-emergent healthcare needs and is a very good alternative to visiting an emergency department for emergency issues. So from a volume perspective, like we've seen over 93,000 visits last year at our adult emergency departments. I mean, this amount of volume is certainly increasing wait times for our patients. So we're very hopeful this urgent care center will provide a new additional access point. This will be a new service for non-emergency patients in the metro region, which we hope will alleviate the pressures and challenges at the emergency departments. So the center, a little bit about it itself, would be 20,000 square feet, a very significant footprint. And we have a goal of seeing over 100 patients a day. That's going to equate to about 36,500 patients per year. So a significant amount of access that we're going to improve through this. So some of the features of the center is going to have X-ray, including ultrasound. We'll have blood collection. We'll have treatment rooms. And, you know, it's funny to say, but we're going to have easily accessible parking. And for people who used to accessing the health science, this is going to be a very big plus. I mean, this new offering will take the pressure away from our city EDs. That's what we're hoping. It's going to improve access for our patients. It's going to provide the right care, yet, you know, at the right time and at the right place, you know. Hopefully, what we're hoping here, this is going to be, it's going to respond to the needs of our patients, while at the same time, you know, it's going to help with the desire of our providers. Our providers want this. So we're hopeful. We're hopeful that this is going to take away some of the pressures in the system. And like we said, the RFP is called today. So thank you.
Okay, I'll open it to questions.
So this is an existing to services that already exist. How, I mean, we're already struggling to staff the existing services. How are we going to staff this additional service?
Yep, that's an excellent question, because there is a challenge not only in this province but in every province in Canada in terms of healthcare professionals. That is recognized, but we are focused not only on recruitment nationally but internationally. We have put in place a world-class recruitment complement within the Provincial Health Authority that is now staffed up. Previously in the province, and in fairness to those who were recruiting, it would be a vice president, a VP of medical, for example, that would be responsible as well for recruitment. So they would do it on the side of their desk. That was happening in times when recruitment wasn't a significant challenge. It is today. So we've established a recruitment office in the department. We've established the world-class recruitment center in the Provincial Health Authority, staffed with full-time recruitment staff who focus on recruitment. We've undertaken recruitment missions internationally. We'll continue to do so. So we are hopeful that, you know, we've seen the worst of our healthcare shortage challenges, and we're going to start being able to staff up with the recruitment efforts we've seen.
What's the anticipated date for this to be open?
So basically the RFP was called today, March 14th. It will close on April 27th, 6 weeks. And there's a stipulation in the RFP that the building has to be fit up within 12 months.
So by like the end of April next year?
End of April next year, at the outside.
Minister, do you foresee this this type of center being built in other parts of the province?
We do, especially in urban centres where we have emergency departments. So we are undertaking, this is part of the Health Accord, part of the overall plan to reimagine the delivery of healthcare, modernise the delivery of healthcare in the province. The Premier has been very focused in terms of putting together the folks to implement or put in place the Health Accord, and part of the recommendations on that is finding efficiencies. This is one of those efficiencies where our emergency departments have been overburdened, and many of the cases presenting to our emergency departments are lower level acuity. They can easily be dealt with an urgent care centre.
Do you see this as a solution for parts of the province where they're having trouble staffing emergency departments and keeping them open regularly?
Well, emergency departments into the future, especially in urban areas, will be emergency departments. There's a difference in if you come in and you need stitches, that's urgent care. If you come in with a life-threatening condition, it's emergency. So the focus will be, as we move forward, making our emergency departments more efficient so that people with emergencies will have a lower wait time. And Dr. Radofsky, did you want to speak to this as well?
Sure. Yeah. I mean, there's lots of different scenarios where a patient might require care that's beyond what's available at a standard primary health care setting or, your classic family doctor's office, but doesn't quite meet the threshold of an emergency department. So some examples would be, lacerations that require stitches, as the minister said, or soft tissue injuries, or somebody who's unwell that needs a little bit more investigation with lab work or diagnostic imaging. So an urgent care center provides that opportunity and that access point for those patients to get the care that they need at the right place. By default right now, those people are all flooding to the emergency rooms when they're not true emergencies, but it's the only option that they have. So the urgent care will help offset that.
Sorry. Are you concerned that people aren't going to know, which center is appropriate for the care they need, and how can you address that?
Sure, yeah, I think we can address that multiple different ways. So with really good communication at the outset of what the urgent care is meant for. In addition, people can avail of 811 if they're unsure, and they can help direct people to the right place for the care that they need. And then, of course, when they enter the system at the checkpoint for the urgent care center, if they're not in the appropriate place, then they'll be redirected to where is appropriate.
Yeah. And, emergency responders will have another option now to go to urgent care when they know that an individual requires urgent care as opposed to emergency. If a patient is in doubt, obviously go to the emergency department. But if somebody know they have stitches or require stitches or they have a strain or, they know that that's urgent care. So individuals oftentimes will know if it's stitches or if they've lost a limb. There's a difference in where they go. But if in doubt, go to the emergency department. This will obviously divert a large percentage of the folks that know that they require urgent care.
More on Mark's question, would maybe like a public education campaign be part of this to help people learn about where they should go?
Absolutely, and Dr. Radofsky had just said that proper communication up front. So did you want to elaborate on that?
Sure, yeah, I think like all new things, communication is really important so that people can understand, because there's a change management piece, and just so people are really understand at the outset where is the appropriate place to receive their care. And again, providing people with checkpoints where they can ask those questions if they're not sure. So 811 always, or if they have a primary care provider, they can check with them, or going to the actual emergency room or urgent care center as well.
Why has urgent care not been kind of like part of the care continuum up to this point? Is it just like...
Well, I think the Health Accord sets out a 10-year plan. There is a very solid plan in place for the transformation of healthcare in the province, and that is part of what we're announcing today, is part of the plan to transform healthcare in the province.
So kind of frame that a different way. Is this something that is like being done elsewhere that you guys have kind of been following? Like, is this kind of a new way, a new thing in general that's being changed in the healthcare front, or is it just new for us?
So the province and the health authorities have been looking to best practices in other locations. Urgent care is in practice in other locations, and it has proven to be very successful.
And so currently, it would just be Whitburn and now this one, right, for the province so far?
Yep. Well, so the difference between Whitburn and St. John's, so this is the second urgent care. But Whitburn, we've given the commitment that we will continue to meet the demand of the community in Whitburn. There's a difference in the scope of practice for whether it's a doctor or a nurse practitioner or even a nurse in terms of responding to emergency and urgent. We've had challenges recruiting in Whitburn. The model in Whitburn is meant to get the doors open and start dealing with the vast majority of patients that would use an emergency. Over 80% of those cases that have presented to Whitburn in the past would have been classified as urgent care. We will continue to grow in Whitburn to meet the needs of the community.
Speaking of Whitburn, there are protesters outside Confederation Building right now from Whitburn who are still demanding 24/7 emergency care in Whitburn. Could you just speak to those protesters right now and what they're demanding?
Absolutely. I mean, I don't see Whitburn as an all or nothing. We had challenges recruiting to Whitburn to simply say that, we're holding out until we can staff it up as an emergency department would see the doors continue to be closed for the foreseeable future. Putting an urgent care model in place in Whitburn gets the doors open, quite frankly. Right now it's 3 days a week. We'll continue to recruit until we are able to staff it 5 days a week. We'll continue to recruit until we're able to staff it 7 days a week, 12 hours a day, and then continue so that we get further into the evening hours. In Whitburn, we are building on a centre that has been closed for 8 months and, gradually building it back. So that is the difference between the urgent care, which is intended to be urgent care 12 hours a day, 7 days a week in St. John's, and something in Whitburn that we will continue to staff as the need shows.
The urgent care center won't be ready for a year. Are you worried the unprecedented pressures in emergency rooms are just going to get worse?
Well, we've been addressing in terms of recruitment the pressures in the emergency department. We are, we've got an RFP which is undergoing assessment right now for a virtual physician to respond to people without primary care and to assist in emergency departments that may be on virtual. Providing that service should reduce the volume in emergency departments once that virtual physician care is available. Right now, as Dr. Radofsky has indicated, many people have no choice. If they don't have access to primary care, they have no choice but to go to the emergency department. So we're taking measures in the short term to alleviate the pressures on the emergency department. Announcing this today is the first step. Getting the space, getting it equipped, getting it staffed up is the next step. But within 12 months, we will have the urgent care center up and running, which will take considerable pressure off of emergency departments. So, this is a huge step forward today.
What other recommendations are you looking at from the health accord? This is kind of a more major one than some of the recommendations we've seen in the past. Like, what else are you looking at? So
we put in place, right now we have 8 family care teams, referred to as collaborative care teams. I think we're making the switch to family care teams because it's easier to say, and B, people understand it more. So the 8 family care teams that we have in the province today, we have budgeted for a number of others in the upcoming budget. So that is, we're looking to have 35 family care teams over the course of 5 years. So we're already a year into that, and we have 8. So over the course of the next 4 years, we'll reach 35. Anybody in the province who wishes to be connected to a family care team can be, within the 5 years. That is one of the examples. We're looking at the integration of ambulance services in the province. We've started on that path in terms of reviewing and looking at it. That's obviously another example. Heart Force One, where we bring patients from around the province to the Health Sciences Complex for cardiac cath, is another example. Getting hip and knee replacement in St. Anthony with the traveling orthopedic surgeons, and then into Carbonear is another example. So, the list goes on. We've undertaken a number of initiatives outlined in the Health Accord already. This is yet another. We are, moving efficiently in terms of implementing the recommendations. Another one is the panel of experts looking at personal care and long-term care homes. So, we're not wasting any time in implementing the recommendations of the Health Accord. It is a 10-year plan, but we've already met many of the objectives outlined.
Is there any update on St.
Yep. So I mean, St. Clair's is another example, and we have to announce projects. Obviously, before we know what the project looks like, there will be a team put in place based on the RFP to design what the facility looks like, to design how many beds, what services should be in the facility, based on the health accord. What services are best at the health sciences complex, what are best at the replacement for St. Clair's. So part of the RFP will be the design of the facility, improved design, modernized design, which in and of itself will help recruit healthcare professionals. When we're recruiting healthcare professionals now, they want to know where they're working. And if you tell them they're working in a building where parts of the building are 100 years old, it creates challenges in getting them there. The emergency department, for example, at St. Clair's is very cumbersome and challenging, not only for health professionals but for patients. In terms of where we are, Ron, do you have an update in terms of where the RFP sits now?
Yeah, so basically there's a team of people assigned to the RFP. The RFP is about to be called for that piece, right? So not the build, for the actual
The design
and the what we call the programming, how the building will work inside. So it's all on track. I'm anticipating that we'll get some results back as early as the end of this month. So it's all moving along, and lots of people assigned to it. It's very exciting. I mean, all these announcements now are very exciting to get this amount of infrastructure to support health. It's wonderful, really.
Have you settled on if you're going to do that one as a P3 yet?
No, I think, part of the RFP and the design of the building, and when they tell us the, estimated cost of the building, that will be part of the consideration on which model we'll move forward with. So no decision has been made on that at this point.
So the Provincial Health Authority will launch April 1st, and the new model will be geography-based, so it'll be zones, and the RHAs will be dissolved. Can you explain what those zones will be and how it will operate any differently from the RHAs?
Yep, absolutely. And that's another example of a health accord recommendation, by the way. While we were talking, I was thinking of Dr. Connors, who said the best day of his entire career was the announcement of the Cardiovascular Stroke Institute, which was another example of health accord recommendations. But in terms of, so there will be 5 zones outlined for the new Provincial Health Authority. We can get you a mapping of those zones, but essentially 3 of the zones are what is in place now in terms of Lab Grenfell, Western and Central. St. John's will be St. John's Urban and St. John's Rural, or the Eastern Urban and Eastern Rural, sorry. I misspoke. So Eastern Urban and Eastern Rural will be the zones. Each of the zones will have a health council in place to represent the unique needs of the zone. Each of the health councils will have representation on the provincial board to ensure that the provincial board has an understanding of the unique issues within each of the zones.
Who will be on the zone councils?
So that will be determined. With the assistance of the Public Service Commission, we will look for recommendations on who should be on those. So there's 2 different levels, and the board is a Tier 1, so that will go through the Independent Appointments Commission. The zones would not be Tier 1. They will be recommendations by the Public Service Commission.
Or could that be like politicians, or would it be like people working in the facilities, or would it be both, or?
So ideally what we want to see on the zones is a variety, a wide array of expertise. You want people there with an understanding of accounting, an understanding of healthcare, an understanding of a business administration. So ideally you want a mix of backgrounds and understandings on the health councils. Certainly what we want to see on the health councils is people with a dedication to the delivery of health care in the zones that they represent.
Will those be paid, and will they cost extra?
No, the health councils will be volunteer positions, similar to the trustees that are in place right now, the trustees within the different zones.
What's the new health authority going to be called? Is there a name?
As far as I know, at this moment, the Provincial Health Authority. I mean, that's what we've been calling it. I haven't heard of any suggestion to call it something different. So I believe it's going to be the Provincial Health Authority. Okay. Well, thank you, everybody.